why don't we just get started, and why don't you tell me a little bit about, where you live, how old you are, what do you like, things that you like to do, and then we'll get into your kind of medical history.
Okay. Well, I live at the southern Oregon coast, so that's the background there.
Beautiful.
Yeah, and I'm in my early 60s, and my background is I work in a technology company, so I telecommute. I'm doing this since a dozen years, actually, not just since COVID. And yeah, so my education is in science and chemistry. Um, got a PhD there, so that's my background. So far, so good.
One of those brainy people.
I wish.
Okay. So, why don't you tell me a little bit, first of all, where's your area of pain and when did it start and how did it start, all that kind of stuff?
It started about 10 years ago, and it was in the right hip, and it started with a clicking hip. It did noises, and the pain wasn't all that bad at this time. The doctor prescribed physiotherapy, and that was, however, interestingly, mostly stretching. So no, nothing like what your method recommends. Oh, and and that worked for a little while. An ultrasound, they did ultrasound on this. That was good for a while, but it got worse and worse and worse. And about
Yeah.
5, 6 years ago, it got really bad. And then it got better again, and I got really bad and bad and bad, worse, worse. So, and it was so bad last year in winter that I visited a doctor finally for good, and he sent me to an orthopedic surgeon, and he recommended hip replacement surgery. And I got a second opinion, and that one said the same thing. And they showed me all the things which are wrong in my hip. There is structural damage. The cartilage is worn off, and there is a labral tear, and there's a bone spur, and the angles where the ball and the joint go together. This is like all screwed up, and so on. And your favorite, my doctor found also that one of my legs, the right leg, is longer, was a
Yes.
centimeter longer. He measured
Right.
it. Well,
Yeah.
I know you have that statement.
Yes. Yes. And do you remember, did they measure from the top of your pelvis to your foot, or is that how they did it? Or do you remember?
Yeah, and I think that's what he did.
Yeah. Yeah.
Yeah,
That's why they found it. Okay.
that's yeah.
Yeah. So you had all sorts of goodies going on in that hip there.
Yeah, indeed. And I couldn't walk anymore. And one of the orthopedists actually a while ago had even suggested I use a cane. So I did that too. That helped a bit.
Gosh.
And then after the leg longer, the doctor suggested I put an inlay into the other shoe.
All right.
And then however, I was scheduled for hip replacement surgery because it was really, it looked like it.
Yeah. And you seem to be pretty active. So I'm going to guess that this really impaired a lot of your
Yeah,
activities.
yes.
What kind of things do you do? Um,
Well,
on
since I'm now in my mid 60s, I replaced all the wild sports with walking and gardening or fiddling for contra dance.
Right. Yeah.
Those kind of more harmless things. But in the past, there was kite surfing and
Oh
tennis,
gosh.
skiing, and whatnot. So, yeah, as you said, and I think that was, I love moving and loved working with weights and resistance, and I couldn't do any of that, not even
Yeah.
gardening so well anymore.
Okay. And so
So,
since you're feeling better, are you able to return to any of those activities, especially kite surfing?
no, I wouldn't do that. But I gave that up just because of getting more reasonable, with getting more
Yeah.
mature.
Uh-huh. Right. Some of us, it takes a little while.
Yeah, yeah, no, but the one thing is that's why I felt also really uncomfortable about the idea of getting an artificial hip joint. That was just didn't sound right. And the inlay
Yeah.
in the shoe felt wrong. That was not, no. So None of that. So now, now I'm back to doing everything I want. So
Great, great. And how long has it been since you started feeling better?
it's actually pretty much after I started reading your book and we had our first Zoom meeting where you
Yeah,
gave me a lot of good hints, and your observations are so good via Zoom. You said like, oh, I'm doing this or that, and the legs are this or that, so I should do this or that, and I was right on. So maybe needless to say, I canceled that hip replacement surgery. I didn't have that.
good.
And instead really started working according to your book, and did the exercises and watched the videos. I got also the supplemental videos, particularly, they were very helpful, and to do it right. Um,
Are you talking about my hip pain home program?
yeah,
Yeah.
exactly
Okay.
that.
Yeah.
Exactly. The cool thing there, which I hadn't gathered before, is like for the gluteal pumps, you can put weights on onto the leg.
Yeah. That was a
So
new one. I was working with an 80-year-old woman with severe arthritis in her hip, and we got her up to 20 pounds behind each leg, and no
yeah,
pain whatsoever. As long as we kept her glutes nice and strong and kept her walking well. So
it's
she
amazing.
she has become. That's who I use to shame everyone else when they say, "No, you can't do." No, 80 years old.
Amazing. Yeah, I'm not yet at 20 pounds, and that's only because I don't have a 20-pound dumbbell. So I
Yeah.
will get one, but I'm at 15 and that works just fine.
Yeah, clearly 20 pounds isn't necessary. She was
Yeah,
doing some things where she needed some extra strength there. And
yeah.
since she had some really pronounced structural changes in her hip,
Hmm.
I just felt that she needed to be as strong as possible. She also
Yeah,
had balance issues and all sorts of things. So
yeah,
I just wanted to get that strength way up there. But you don't need 20 pounds. You're fine at 15.
yeah, yeah. Right. It feels like that.
Yeah,
And
good.
but it's so easy now that I'm like, okay, maybe I get a 20-pound dumbbell
Yeah, well,
because it's fun. It feels good, you know.
yeah.
After those exercises, and especially with the tubes, the hip tube exercise, it feels so good. I mean, it's
Yeah.
like a big difference already right there.
So Sylvia, what do you think? So it sounds like your pathway, you bought my hip pain book, you did some of those exercises, they seem to help a little bit, then you went with the hip pain program. And then, so why did you feel that you needed a Zoom consult with me even after you bought that hip pain program? I'm curious about that.
Um, because it was when I read the book, I'm not very good with detail. So I read over it, looked at the pictures, did my thing, and was like, yep, it worked some, but then I walked to the videos and I saw more detail, and then I had questions suddenly. And so that's when, and you follow up with people who register with the book. And so I took the opportunity, and
Okay. Yeah.
that made a difference. It was really an important part in the puzzle.
Okay. Was there what was the information? Because my whole goal with these home programs is to make it so you don't need me. Because I
Yeah.
want you to feel independent. So what was the new information that you didn't get in the home program that you got via our Zoom presentation? I'm just kind of curious about that.
Yeah, so there was one was about how to walk
Uh-huh.
properly, with the knees bent and a little bit so the weight forward at the gluteals, and so on, and the way how to feel whether your gluteals are firing or not. And I had my hands in the wrong place, and you saw that. You said, "Oh no, you
That's
need
right.
to up."
Yeah.
Um, and I didn't feel there anything either because they now I do.
Good.
Nothing. Very different. The other thing was you also mentioned that because of the pain for so long, my body was a little slanted to one side. And you recommended that I put the arm up like this,
Yes.
not all the time, but just here and there shortly, and walk like this, and that would kink it out over time.
Yeah.
And that felt really good too, and that worked really nice. Um, those are the two I remember. I could I have notes somewhere. I
Yeah,
could.
I know I have the gluteal walking in the home program.
Mhm.
And I thought I had that arm up part too, but maybe I didn't. I thought I did. So I was just kind of curious there. Uh, you know, I'm glad that was meaningful to you. Did we also identify that you had an anteverted femur? Did we talk about that, or a retroverted femur
I
or not?
think, yes, we talked about this, and I think you said introverted. Yeah.
Yeah, I think I remember you having an antevert, which for those of you listening or watching, that just means that the thigh bone is rotated in. So not everyone's thigh bones are shaped the same. Usually most females' thigh bones are rotated in more, and most males' thigh bones are rotated out more. And so uh, this has some consequences for how you use your legs. For women, because they're rotated in more, you have to get that butt really strong to counter that inward rotation because your hip joint doesn't like that internal rotation like that. So
Mm.
so I'm glad that you're doing 15 pounds on your glute pumps because you're going to have nice strong butt to counter all of that internal rotation of your thigh bone. Yeah.
Yeah. Oh, that's interesting. It counters that. Yeah.
Yes. Yeah. We need to control it. We're not going to stop it completely, but if we can slow it down so it's controlled, then
Hmm.
that's much better on the hip joint. Not a hard hammer anymore.
Yeah.
Yeah.
Yeah. There were other things I learned from you, and I don't even recall. I think it was one of the videos, and whether the advanced ones or included ones. I do a lot of other things different now too, just after your advice, and it might have been the conversation. One is how to just lie down in bed, to have something. Most people put a pillow between their legs. You say it can also be under both legs, interestingly.
Yes.
I never liked any kind of a pillow there extra, but now I'm doing this and got an extra nice, like a thicker pillow, and that works wonders. It's
Yeah.
amazing. That helps. Yeah.
Yeah. So for those of, there's a lot of people out here, hopefully, who are watching this or listening to this who are just like, gosh, what did she do? How did she get rid of that pain? And it
Oh,
sounds like the walking one was a big deal for you, right, Sylvia?
yeah.
So
Oh, yeah.
so so what was it about the walk? If you were going to teach the people at home to walk correctly, how would you have them go about that? What has worked for you that you think would work for them?
Yeah, I think for me the key thing was to not use straight legs, which I
Yes.
did before. And instead have just the knee slightly bent, and that automatically seems to do the trick. And I don't even think about it anymore. And the same is true for standing. I always stood with straight legs. That was a habit. And now I don't do this anymore. Um,
Yes, you're absolutely right. I've been a guest on a lot of podcasts, and I always talk about the knee locking as a
yeah.
big source of problems for back, hips, knees, feet, whatever.
Hmm.
And it's so nice that you confirmed that yourself, that was a big deal for you, because it is a huge deal for people, and
Yeah.
it seems so innocuous, just this tiny little thing.
It's a small thing. And that was the other interesting thing in the Zoom meeting. The extra little tip you gave was you said, walk on your toes. And I did that, and that activated the gluteals. And you said you cannot be walking on your toes and have straight legs. Maybe it's true for some some people who balance on high heels, but
Yeah. Yeah. No, you're absolutely right. And so I had a choice of to put both of those ideas or just one of the ideas about how to start the butt
mm,
activating during walk in the video. And I went for the second one, the one where you unlock your knees in the like the ice skate walking type of thing. And because the tiptoe, that one works every single time for everybody. But the tiptoe working works most of the time for most people. And I decided to go with the second one for that reason. But for those of you listening, what Sylvia is talking about is to activate your butt. If you can go up on your tippy toes and walk around on your tippy toes, what it's going to do is it's going to force your knees to soften, and it's going to force your body to be over your foot at foot strike. And when those two things happen, it turns on your butt muscle. And the turning on the butt muscle is critical for getting rid of hip, SI joint, sciatic, back pain, all sorts of problems. All right. So, and then what you do is you walk around 5 or 10 steps like that, and then you slowly lower your heel down, and your butt should remain turned on. As long as your knee is soft and your body is over your foot at foot strike. So, all right. So, okay. Well, that's interesting. I'm glad that you like the tiptoe walking.
Yeah, that was very interesting. Just the experience of having the gluteals working or not, that was an eye-opener back then, really.
Yeah, yeah. So given that, so what do you think, you've read my hip pain book.
Mm-hmm.
So what do you think was actually causing the pain in your hip now that you've solved it?
Now, after reading your book and solving it, it's a big question I also had for you. I believe my gluteals were underused and atrophied, or just not the nerves not working there, because I have a secondary job. I sit all day long, and when I work out, my the other leg muscles are very strong, and they just compensated for that. So the gluteals were just asleep. I believe that's the reason, but I wanted to verify with you.
Yeah, so you're halfway there. And
Mm-hmm.
so I believe that you had something called an anterior femoral glide syndrome. Do you remember us talking about that?
Yes, we
Yeah.
were.
And
Mm-hmm.
that's in my book too. And what that means is that the femur head is sliding around in that hip socket too much. The
Yeah,
main controller of that thigh bone in the hip socket is the butt muscle.
yeah.
And so, and that's why that, and I can't prove it, but I believe it's that sliding around that has caused a lot of the arthritic change and the labral tear and whatever bone spurs and things like that that have occurred in your hip. What I think would be fascinating, Sylvia, is if you were pain-free for a year, to go
Mm-hmm.
back and have another x-ray of that hip and see if those changes have changed. If the arthritis is decreased, the bone spurs. I had one patient who did that. He was scheduled for a hip surgery, and he was bone on bone. I worked with him for 8 years. He was pain-free for 8 years. Finally, those structural changes caught up with him 8 years later. But in that 8 years of time, they had changed how they did hip replacement surgeries.
Yeah, right.
And so now it's so much more successful than it was way back then.
Yeah.
And so anyway, the doctor took another x-ray of his hip, and lo and behold, he said, I can't believe your cartilage has gotten thicker since the last time we looked at you. And that's the big deal, right? So that's the only evidence I have that, your body will adapt positively by removing damaging forces to it too, I believe.
Yeah, I completely agree. And actually, that was my thought too, that in 2 years, not 1 year, I wanted to go back and have an X-ray, maybe an MRI, to even see a little deeper on everything, how that looks like. Because I'm sure the bone spur will retreat, because that's probably the hip stabilizes itself that way.
Yeah.
And with that, I also think that bone to bone will maybe scar over with some whatever scar cartilage, and the rest will be just fine, I hope. And by then, maybe later, maybe some stem cell therapy or something, some miracle can cure it better than surgery.
Well, I think, the deciding factor is, are you pain free? And
Mm-hmm.
are you doing the things that you want to be doing? And if you
Yeah.
are, then there's not even any reason to get the stem cell, right? But
No.
for my own personal curiosity, and maybe yours now, it would be, okay, I'll accept 2 years. If you want to go back in 2 years, that's fine with me. But that would be a fascinating, especially if you have the x-ray images from your initial x-ray.
I do, yeah.
So to put those side by side, I think would be
Mhm.
really fascinating to just look
Yes.
at.
Yeah,
Yeah.
absolutely. I want to do the same thing.
Okay, great.
Just for curiosity, just curiosity. I don't know
Yeah,
how long the pain-free will hold, ideally the rest of the life, but I mean, the structural damages, some like the labral tear, that will probably not heal.
right.
Um,
It
will
likely won't.
Well, yeah. But if it's pain-free, my God, I mean, I cannot ask for more.
Yeah, and the reason I think that you should be pain free is because you've got the worst of the structural damage now. It's
Hmm.
only going to get better if it can.
Right.
And
Yeah.
you've gotten pain free with that structural damage. So
Yeah.
why wouldn't it continue for 2 years, right? Unless you stop doing the things, fell back into bad habits or something like
Oh, yeah. No, I will not fall back. I'm very motivated. Not
that.
fall back.
Well, that's wonderful. So this is always something I'm really curious about, because what I try to explain all of this kind of stuff in my book and also in my downloadable home program. But I find that, well, you're a scientist, so that may have made it easier for you. But the biggest thing for me is to get over, I have to teach people how to think about their pain differently in
Hmm.
terms of how it's relating to their body. Do you have anything to say about that? How are you thinking about these things differently now than when you started?
Yeah, that's a good question, because in the meantime, we talked to a number of people in our circle of friends and relatives where people were in a similar situation and their hips were giving out. And I don't know how many, if any, of them got motivated enough to do your program. Sometimes we even just hand the book over. And so,
Yeah, that's fine.
yeah, no, we give them a new one. I'm not giving mine away. I need that. But so I think it's in the personality maybe of people. And so I always liked to work with my body. I'm a physical person, and that helps. And I like to work with weights or resistance and the resistance bands. So it's more natural for me. And I think for a lot of other people, it's too alien. And to get on the floor on all fours and do gluteal pumps is maybe really even hard for some. They cannot get up again easily.
Hmm.
So I'm in a much better shape than that from a mindset. Um, I don't have a good answer to this other than that. It's if you love your body and you feel it and you want to do things, that should
Yeah.
get you.
And and I agree with you about getting on the floor. A lot of people can't do that. And that's why I think in the home program, I have a modified version where you can do it on your
Yes.
kitchen countertop too.
Right.
So I guess one of the things is that I'm just wondering, I wonder about a lot is I feel like a lot of people don't feel in control,
Hmm.
like of their pain or their body or something like that. And that, oh, well, this is the way it is. I just have to go down that road. Did you feel like that at any time before you started all of this, or like, oh gosh, or did you
Um,
always think that,
well,
oh, I know I should be able to change this? Did you always think that?
I always think I should be able to change that.
Yeah.
And had a similar good experience with asthma. I had it and I don't have it anymore because there were a number of things I changed and now it's good. No more allergies, done.
Wow.
So there
Awesome.
is like this, I don't know, when it comes to the body is my castle. So it's really
Yes.
a sacred place. I wanna do the best. And the idea just of a surgeon cutting in there or so, this is the very, very last resort. And I think for many other people, it's different. They trust the doctors and the medical process and procedures and surgeries. And I trust less there, but less more in options and first trying to find alternatives.
Yeah. Yeah.
It's a
Well,
mindset thing.
it is a mindset, and that's the thing. And I don't blame people for having this point of view, because they've most people in your position have been through several practitioners, you
Yeah.
know, and like a doctor will send you to physical therapy, and like your physical therapy didn't help you.
Hmm.
So they tick that off like, okay, I've tried physical therapy.
Hmm.
But I always explain it like, well, if you ate at McDonald's and didn't like it, would you then not like all restaurants? You know, it's the same thing, right? Because
Yeah,
they're
that's true.
there's a huge umbrella of possibilities out there.
Yeah.
And not only physical therapists, chiropractors and massage therapists, yoga, acupuncture, all sorts of things. So, but it's just something I'm constantly trying to get at this kernel of how to reach people and let them know that, you know, there's a good chance we can turn this around.
Real.
It's
real.
And I haven't quite figured out the reason why most people don't feel that they can turn it around. And that's the only thing I can point to is lack of previous success so far.
Yeah, or maybe not understanding the concept behind it, because you use also in your book very medical terminology, which is the right thing to do, and you have the nice illustrations, but it only for me even became clear after we talked and after I started to understand what the gluteals are really doing and why it's working. And it's like, dang, yeah, of course, now the joint moves differently. And the injury was because it was moving falsely before. So this is, there is something about it. Maybe if they're little cartoon illustrations which move or so.
Yeah.
Some people are visual, some people are more thinkers. And
yeah. So in the hip pain program, remember that watch this first video at the very beginning that I asked everyone to watch, and it explains my approach to solving that area of body's pain. Did you watch that one?
I did watch it, yeah.
Did that help explain anything that I had maybe missed in my book?
You know, it's a process, the understanding and the learning. And when I listened to the video and watched it, I was more focused on like, okay, the exercises, how do I do it? What do I need to do?
Yeah.
That's where the attention and the focus is on. It was not yet on the like, wow, why does it work? That came once it worked. I was like curious.
Oh, okay.
It was more this process. It was not right from the beginning. If somebody would have told me early on, more like, yeah, I don't know, in a different way, a different focus, that your gluteals are atrophied. If you build them up, your bone will move differently and the joint will rotate differently inside the hip socket. That will take care of it. That would have shed light on from a different angle.
Got it.
It's hard to say, but everybody learns at their own pace.
Yes. Yeah. One of the things, Sylvia, and I'm wondering if this happened to you at all or whether you were able to control yourself, but a lot of people who buy the hip pain program, they'll do the pain reduction exercises for maybe a day or two. And then they jump into the restoration exercises, because I think all people think I've got to strengthen my way through this thing, and I've got to go to the most advanced exercises possible to get there. But they're missing. This is what I'm finding through a lot of emails back and forth with people, is that people are skipping over the things that will solve the pain, which is the pain reduction portion of the program. And did that happen to you? Were you tempted to do that at all?
So that's funny, because for me, I have, and again, it's because all other muscles are strong and joints, and I feel like in a really good shape. I just went right away to the gluteal pumps. There was also one thing in the Zoom, you told me about how I can bump it up a little bit more. So I went there and did this for strength then, and the hip tube things that worked right from the beginning, that's pain reduction. And I never changed it. Those are my two go-to, and I do them every day when I can, and I think about it, and several days a week, sometimes 2 times a day, and ever since the beginning. And that's all what was needed. I tried the other things, and that's all. That's nice, but there's not enough time in a day, and those two, that's quick and it works.
Yeah. And I think a lot of people, at least this is what I'm hoping, is that, you know, your two will be slightly different than someone else's two. And what I'm really hoping is that people just, you know, once they can hone their program down, it is so simple to maintain. Once you found the thing that's going to, or two or three things that are going to fix you, it's so simple to maintain that program. And I bet because you're walking better, you probably don't even need to do those glute pumps every day or every other day even. So
you may be right, but I only walk 3,000-4,000 steps a day. I don't have the opportunity right now to do more.
yeah.
And so that's why, and I love weights, so it's like,
Yeah.
that
Yeah.
anyway.
Yeah. Okay. All right. So, do you have any questions for me after all of this that we've talked about and your process of discovering what's going on, what's worked for you?
I think you answered the biggest one for me. Again, what is the explanation for why am I now pain-free?
Yes.
The next
Yeah.
question is, why don't you teach that in school? Everybody needs to learn about this.
Yeah, I agree. I train all of my therapists at my clinic, or have. I sold my clinic a few months ago, and to focus on this online, world clinic instead. And none of the therapists knew about this. This concept has been around for 20, 30 years.
Yeah.
And it's not new. It's just not being taught. Same with a lot of things that I have in these programs. It's not new. It just hasn't been taught.
Yeah.
Which perplexes me.
Me too. I mean, right, the awareness of this is like, hopefully, I mean, you do a lot of activities to promote the method. So, and I just hope that a lot of people learn about it, because it really helps. You don't need a surgery.
Right. Yeah. I even interviewed the professor who developed this whole approach.
Oh, okay.
All the biomechanics, and Dr. Shirley Sarman out of Washington University in St. Louis. She was my very first podcast interviewee.
Wow.
And that was my question to her. One of my questions was, why? I mean, she's been teaching this for 30, maybe even 40 years.
Yeah.
And I said, why isn't this standard now? She is just scratching her head. She doesn't understand why. Even her own students at her own program don't use it after they graduate. And I'm just like, oh my gosh, what is going on here? So
that is so unusual. Yeah, I heard her name before, because then after working with you and all, I started browsing the internet and YouTube, and it comes up here and there, and she is a big name in this
oh
whole.
my gosh. Yeah, she's like the Meryl Streep of physical therapy. She's won every award that you can possibly win. Brilliant. And her work is largely unnoticed. And to me, that's sad, because I believe it's that lack of awareness that is creating chronic pain in our society.
Absolutely. Oh man, I wish I would have known about it 10 years ago, because then probably the structural damage would have been much less already in my hip.
I would tend to agree.
Yeah.
So do you have any other questions for me, Sylvia? Or I'm just so happy, and thank you so much for talking to me about this. I know you're busy, but to talk to someone who's used my program, I'm just so curious mentally how this has been for you, and the struggles that you had and things like that. So any last words that you want to pass on to anyone thinking about anything, their own pain?
I'm just so grateful that somehow miraculously I came across your book and your method and stuck with it, and because it really helps. Everyone out there who has hip pain needs to do those, or knee pain, or whatever pain, because boy, it's so simple. It's really simple and it works. I'm pain-free. I can walk. I can do weight workouts. I work in the garden. I can do things with my hip. I mean, Chinese bending artists would be jealous.
Oh, well, I'm so happy it worked for you, and it makes it all worthwhile to me to hear you say that. So thank you.
It's really wonderful. Thank you for that.
Oh, my pleasure. Well, thank you so much, Sylvia, for spending your valuable time with me today. And I'm always an email away. Just feel free to reach out anytime if you have any other questions. So
thank you so much, Rick.
Okay. Have a great day.
You too. Bye.
All right. Bye-bye.